I had to explain to a 17-year-old girl and her mother that she was not in fact allergic to alcohol, but she was just hungover. She complained that on nights when she drank too much vodka, usually on an empty stomach, that she would feel nauseous, flushed and sometimes vomit in the morning. But it didn't happen all the time, and there were no other typical symptoms of an allergic reaction. I worked at a pain management clinic. In an attempt to combat opioid use, addiction and abuse, a lot of patients were prescribed a medicated cream. It looked a lot like sunscreen, and you just rub it onto the hurting areas. I watched the nurse carefully and slowly explain how to rub it onto the skin, using small, uncomplicated words and going through the motions of applying it several times. But every so often, patients would complain that their cream tastes bad. I once had a child who swallowed a sizable magnet that passed to the intestine and we were just waiting for it to pass in stool. The next day when he came for follow-up we just found out that he swallowed another one that got stuck to the first magnet in the intestine through the stomach wall. This resulted in intestinal obstruction and he was transferred to OR immediately to have them surgically removed. I had a mom and grandma bring their 12-year-old daughter to the emergency room because she was bleeding. Not from trauma or a wound, mind you, the poor girl had started menstruating and the mom didn't want to explain what was happening or started to happen, nor that it would continue to happen, as mom and grandma well knew. On the upside, it was a very quick ER visit once they were actually seen. My dad is an orthopedic surgeon who does a lot of hips and knees and cries with laughter every time he tells the story of a woman who didn't understand how hip surgery works and thought they were going to take her leg off, fix the hip, and then reattach her leg. A woman came in because she got stung by a bee, not allergic and no reaction. It just hurt. Another woman brought her kid in because he got stung by a bee, not allergic and no reaction. An entire family came in because they found a dead mouse in their apartment. A woman came in for a second-degree burn on her arm. That was roughly the size of a Tic Tac. A woman spent like 5 minutes explaining to me that because of all the vaccinations we give dogs we're seeing a rise in dog autism. I like to call it pawtism. Had a patient come in stating that he couldn't bend his knee. Asked him to remove his trousers so I could examine his leg. After he removed his trousers, the reason that he couldn't bend his knee was that he had a plaster cast around his knee. Checking his notes, he had been sent numerous letters asking him to come in for removal of this plaster cast, and as he hadn't attended any of the outpatient clinics, the hospital had assumed that he had removed the cast himself. Paramedic. Got a call for a stroke. Patient had facial droop and slurred speech, says that it feels just like the last time she had a stroke, 10 years ago. Says that the symptoms came on about 4 days ago and she knew the moment it was happening that it was a stroke, but didn't go to the hospital because she thought she could make it go away on her own. Another time when I was called out for a stroke. Clearly the man was having a stroke. Upon doing a stroke screen it looked like the patient had something large in his mouth. Thinking maybe this guy had some sort of oropharyngeal cancer or mass. I asked his wife if this was indeed the case and she looked at me with a very puzzled look. She said no, and then I said, "What is in his mouth?" His wife then says it's a peanut butter and jelly sandwich that she shoved in there. When her husband's symptoms started, she thought it was just that his blood glucose was low, so she tried to force feed this poor man an entire sandwich before she called 911. Job security. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained alcohol and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5. It just ate up the litmus paper. So shortly after he gets to the ICU and he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD. Basically a procedure where they can look at the esophagus, stomach and duodenum with a camera attached to a flexible tube, and the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He of course needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted for another issue. He was down to 90 pounds, from about 150, and was getting fed through a peg tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. Any chance you could be pregnant? No. So no unprotected sex with a man since the last day of your last menstrual period? Well, yeah. Okay. I'm gonna have the nurse come in and give you a pamphlet. Then I'm gonna come back and ask you again. A guy came to the outpatient clinic with swollen left ball. He said he was injected with some cajeput oil by his friend, with his consent, to enhance his performance in bed. I'm a female medical intern and I tried so hard to keep my expression as neutral as possible. My mom works in hospital, and the techs from radiology always have the best stories. Last week they had a male patient with a huge carrot up his butt. He came from a conservative area, by bus, standing because could not sit. It was a 3 hours bus ride. If I ever could change my job, I wanna be a radiology tech. Not a doctor but dental nurse. My favorite was a 30-something-year-old woman who came in for a checkup at the emergency low-cost clinic I worked at. Teeth were broken and almost black and gums are angry swollen, bright red and bleeding by just moving her tongue against them, needed multiple scaling and hygienist appointments and a debridement. Honestly, YouTube has some amazingly disgusting videos of this treatment, but maybe keep the sound off if you don't like the scraping sound. X-ray showed she had all but her wisdom teeth and 10 fillings, root canals to try and save some teeth and extractions for I think 3 but more if the RCT didn't work. Explained everything and did the usual explanation of proper oral hygiene. Asked her if she had any questions, to which she says, "It's okay if I lose this set of teeth, my others will come through." Me and the dentist just looked at each other probably a lot longer than we should have. No words. I couldn't think of anything to reply to that comment. I had a lot of weird and disgusting things happen at that clinic. I actually miss working there. A 20-year-old girl came in with abdominal pains. We did a pregnancy test and she was pregnant. She acted surprised because she was on the pill. I asked her how long she's been on it and if she had been taking it daily, as prescribed. As if it were the most logical thing on the planet, she said she did not take it daily because she did not have sex daily. I looked at her trying hard not to laugh. She only took them right after she had sex with her boyfriend, so like maybe a couple of times a week. One of my patients used to hold in her farts to the point of being in antagonizing pain, because she thought that there was a certain amount of air inside a person, and if you let too much out you'll deflate. I have a few examples. Patient who recently been diagnosed with diabetes, we needed to adjust her blood sugar levels but she kept eating sweets. So we had a talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation she went around drinking a soda. Another guy who had a benign arrhythmia, the heart beats irregularly. He knew that he could get the arrhythmia from time to time, but as long as he didn't faint or got any pain in the chest he could just take a beta blocker and let it pass. But he went to the ER like 6 to 7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran a test we found that he had a pH of 6.97. That is on the border of what the body can have and still have any function at all. Read, he should be dead. But he was awake and clear. We wanted to admit him to the ICU and adjust it with utmost care. But he needed to go home. To eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes that no shrimp sandwich in the world is worth your life, and if there is something else you need to get help with we can help him. But nope, he left. He came back a couple of hours later and we cured his acidosis. But that must have been a mean shrimp sandwich. I was asked by a patient, on the respiratory ward, if I thought his lung cancer might have had anything to do with his 50-a-day smoking habit. Because he smoked roll-ups, and he wasn't sure if they counted. I struggled to keep a straight face, and said yes, and busied myself in his chart. Me, any chance you're pregnant? Patient, no. Me, are you sexually active? Patient, yes. Me, why is there no chance you're pregnant? Patient, because I'm not married. Me, pee in this cup. Patient thought taking vitamin B6 double dose was the same as B12. Had a patient and his girlfriend complaining of fleas. They were covered in red spots that they were picking at constantly. They were meth heads that were picking their skin off and imagining bugs were crawling on them. They were adamant that they had seen these bugs and pulled them out of these sores. Discharge instructions, stop doing meth. An ER nurse told me a horrific story about a stripper who came in, presenting symptoms of toxic shock syndrome. They found a folded dollar bill inside of her. Stripping, as far as I see it, could be an empowering experience for the right women. And I get sliding a bill into a G-string, that's the whole point of the dance. But this poor girl suffered the indignity of having money shoved up inside her. And not a $100, not a $10, even. A single $1 bill. I had a patient on my obgyn rotation who was in her 50s and decided that her clitoris was actually a growth and needed to be removed. She came in 3 different times to talk to different residents over a month and would never understand that she's always had it and it's supposed to be there. We even printed off a diagram of normal female anatomy to explain. Then she started saying her urethra was actually the growth and she wanted that removed. We explained she wouldn't be able to empty her bladder without it and she then demanded her bladder be taken out too. I think she should have been referred to psych. Woman came in for an upset stomach. Had been prescribed antibiotics recently for a UTI and decided to take them 4 times per day instead of 2 times because she thought it would work quicker. Someone called 911 and had an ambulance bring her in because her implant birth control was hurting her arm. Another 911 pints was a woman who decided to use a dish scrubbing brush as a sex toy and now her vagina hurt. Eye pain after welding without a mask. Guy had just gotten a kitten and it scratched him. Showed me 2 cuts less than 1 centimeter long and not even broken the skin. Teenage girl came in by ambulance for flu symptoms. Stated she tried to go to urgent care, but it was closed so she had to call 911. More mothers requesting drug screens and pregnancy tests for their daughters than I can count. Full-grown adults requesting pregnancy tests because the ones at the store aren't good enough. Hint, they're exactly the same as ours. Woman came in for abdominal pain. Didn't think she was pregnant but reported not having her period in 8 months. You could feel the outline of the baby on her stomach. Delivered 2 or so weeks later. Drug seeker came in with a newfound allergy to non-narcotic pain medicine. Stated they made him go anaphylactic. Had been in the ER 5 days prior without the allergy. Drug-seeking mother using her 11-year-old daughter to try to get narcotics. Upset with us because we didn't give her daughter opioids for a bruised shin. More parents bringing their less than 6-month-old babies in for crying or spitting up milk a couple of times than I can count. Unknown rash on skin for 6 months. Had seen his PCP and even a dermatologist without improvement. Guess he thought our ER providers were bigger experts on skin issues than dermatologists. People coming in for abscesses on their arms which just happen to be near veins and calling them spider bites. People so stoned that you have to shake them to get them to open their eyes getting upset because you're not giving them narcotics for their 12/10 pain. It just never ends. Had a patient that got pregnant while on the pill. She was devastated, and couldn't understand how it happened. I asked her how she took it. Patient, I just used one before sex. Me, ma'am, you need to take a pill every day for 21 days for it to work and then you're supposed to take a 7-day break while you have your period. Patient, what? I am supposed to shove one of these up my vagina every day? I'm not a doctor but got told to go introduce myself to a patient, get vitals, history, more info on their chief complaint, start an IV and draw blood for labs. They came in for arm pain and it looked like they had a nasty bug bite on their arm. So the story was she is a stripper, and their Adderall prescription wasn't doing the trick. So they had an idea how to make it more potent. They heard from a friend that if you crush it up, suspend it in water and inject it, it would be more effective. Except she used tap water to dissolve the Adderall before she injected it. This ended up causing a huge abscess and infection at the site of injection. She ended up losing her arm at the elbow. So now she's a one-armed stripper. Had a married, elderly man lodge a marble pestle in his rectum because he was bored. His biggest concern was that his wife couldn't find out. Middle-aged guy lacerated his non-dominant hand with a reciprocating saw, his dominant hand was using to cut PVC pipe under a sink. Diabetic woman said that she uses graham crackers and peanut butter to bring her blood sugar down. Yes, down. Morbidly obese young woman seeking evaluation for chronic knee pain while eating a meatball sandwich in the exam room. Not a doc, but work at an ER. I was putting in charges one night and one of the doctors had forgotten to mark the chart appropriately, so I looked at the diagnosis. It read imagined object in vagina. I went back to joke about this and got the story. A woman came in and said she'd accidentally sat on a cactus and had spines in her vagina. The doctor, with a female nurse in the room, had to go looking and never found a single thing, including any wounds or signs of irritation. When I asked why someone would do that, sarcastically, the doctor on at the time said, "Well, I guess if you've got nothing better to do on a Friday night." Not a doctor, but when I was in college this girl, white, I was dating called me all freaked out that her skin was turning black. This was midday during the week. She said she was going to the hospital. My house was across the street from the university hospital, so I decided to head over to see what was up. She was distraught. I went into the examination room with her and she explained her situation to the doctor and showed him her arm. The doctor just licked his thumb and rubbed her arm. Turns out she was wearing a brand new black sweater and some of the fibers rubbed off on her arms. I used to be a pharmacy technician. We had a patient who thought he is only supposed to use Lantus pen, insulin, once and throw it away. When it was time for next injection, he used a brand new one. He was always complaining that we only give him 10 pens and it lasts him 5 days. Thousands of dollars wasted by this idiot, and yet insurance agreed to override early fill rejection. There was a girl who thought she is supposed to take birth control tablets only on the days she has sex. The vaccine will make you retarded. Crowd in general. Friend of mine is a gynecologist and she told me that once she had a patient come in and tell her that she cannot have sex anymore, because her partners complain that her hoo-ha stinks really badly but she's never noticed. So doc asks questions like, have you been using any new soaps, creams? Are you allergic to anything? And the patient said no. Doc examines patient's vag and the smell is unbearable. She suspects a major infection. Then she realizes that she cannot see inside properly, and she grabs her tweezers, I don't know the proper name, and prods. She hits something cushiony. She starts to pull gently and extracts a tampon, a month-old tampon which was black and green and smelled foul. Patient says, oh, I thought it has fallen out when I had my last period. Recently talked to a patient that is getting ready for surgery that involves usage of robotic arms to help remove the tumors. Allows for smaller incisions and greater precision. This patient starts insisting to meet the doctor when it seemed like the consult was wrapped up. So we get him back in there, thinking maybe she's got another question. The patient says, I still wanted to meet the doctor. And the doctor points at himself and says, I'm the doctor. Patient, I know you ain't doctor but I wanted to meet the doctor. Doctor, you've already met the resident. I'm the doctor doing your procedure. Patient, no, not you. I want to meet the robot that's going to do my surgery. I feel like we should at least shake hands first. Apparently the patient was expecting some metal man to walk through the door. The patient also had cancer cure recipes and was insistent we take notes.